Hi, I'm Santa Clara County Supervisor Dave Cortese, and welcome to our Saturday afternoon COVID Town Hall meeting, COVID-19 Town Hall meeting. We've been doing this for several weeks now, and today, if you haven't been here before, we're going to have an opportunity to hear from somebody who's going to be able to help us from the mental health community here, a leader in our mental health community. I'm going to introduce him in just a moment. Before I do, if you've been here in the past and you're back again this Saturday, you know that I like to give a little bit of a recap on what's happened during the last week since we were here last, what's happening with the dashboard, so to speak, what's happening with the numbers. And the numbers look like this. Cumulatively, we have 15,496 confirmed cases in the county. That's from testing and positive results from tests. Of course, it doesn't mean that's the total number of people who have contracted the virus or not, because not everyone's been tested, and testing didn't start in most of the country, including this county, until well after the virus had begun to spread. So these numbers are also numbers that we believe are finally accurate again after a couple weeks of glitches at the state level. It's the state that keeps our aggregate or cumulative numbers totaled up for us. So keep all that in mind. Again, if you've been here and watched or listened in the past, you know about those state glitches with data. You might be wondering, how do you know these numbers are accurate? And Janice Rombeck from my communications department in our office tells me that they're as good as ever, we believe, up till now, and if we thought otherwise, we would let you know. There's been 222 COVID-19 deaths in this county, and that number is a tragic number. We always pause for a moment to acknowledge it here, and anytime we're talking about COVID-19 and the pandemic. On the other hand, it's a number that in this county has really been relatively low compared to some other parts of the country and some other parts of the state. So as far as that goes, it is a good indicator that things are staying relatively flat. We certainly haven't had periods of large double-digit fatalities every week like we were having when we first started to have these town halls. Hospitalized cases, or hospitalizations as they say, are at 153 right now, which is down. It's down over 20 since last week, and that's very good. The ICU is 45, and that's good, because in both those areas we have plenty of hospital capacity, and the state, we hope, is looking at that because it is important for us, we believe, here in the county to be off the watch list, the state watch list, as soon as we qualify, so that some of the folks that are running small businesses that have been held up, and some of the people that are waiting for those businesses, can get back indoors and start doing their work. We can talk more about demographics. As you've heard in the past, there's been some disproportionate impact from this virus, which is not good, and it's something the county has been aggressively addressing with outreach, increased testing, information, education, you name it. We've invested heavily in that, especially over the last month. And I've certainly been one of those who has pushed very hard to make sure that no community within our community of Santa Clara County is shouldering more of a burden in terms of illness, loss of life, impact to their families than anybody else. So that said, we can always come back to statistics and numbers. I'm glad you're here with us again. I think this is going to be a great opportunity between now and the end of this program this afternoon to talk about something that a lot of people have called in about in the past, and I don't think we've been able to give really good answers, and that is the issue of mental health and behavioral health in general. And our guest today is David Mineta. He is president and CEO of Momentum for Health, the largest private nonprofit dedicated to providing comprehensive adult mental health services in Santa Clara County. From 2010 to 2015, David served as a presidential appointee in the position of Deputy Director of Demand Reduction for the Office of National Drug Control Policy. So he's got quite the experience, but he's not from DC, although he comes from a civically engaged family that has lots of connections back and forth to Washington. David is homegrown product here from Santa Clara County, and I know he loves his community dearly, and just like me, he's putting a lot of work into trying to make sure the community is healthy right now during COVID-19. He started in behavioral health in 1966 when he worked with Asian American Recovery Services throughout the Bay Area. He was also a counselor for the San Jose Unified School District, and later in Santa Clara County's Alcohol and Drug Department. The programs over at Momentum are for individuals living with mental illness, including a prevention and early intervention program, adult and transitional age youth, which would be 14 to 24-year-old, outpatient services, employment services, day rehabilitation services, residential treatment, supportive housing, and a volunteer program. So if you're interested in any of those areas, he has that experience. They, at Momentum, work to reduce and eliminate the stigma that surrounds mental illness and mental health care through community relations programs that include promoting education, diversity, and collaboration. You know, again, we've received a lot of questions because I think there's a lot of concern out there with businesses shut down, with people on unemployment, with people isolated, with people sheltering in place, with the elderly, with young people that are normally in schools, even with older students who are displaced from their universities. The impact on people's mental health is something that we're all concerned about. And as I said, rightfully, people have been asking us, what are you doing about that? What is the community doing about that? And how bad is it? So, David, we're hoping you can fill us in a little bit from your perspective, from where you sit in this community, trying to deal specifically with those very problems. What it looks like from your vantage point. Maybe you could say a few more words just about, you know, what do you do? What is it like being David Mineta on a day-to-day basis in this kind of an environment?
Well, first off, if I could just want to thank you, Dave, for doing this. This is these town halls during the pandemic, the communication out to the community. We hear constantly about, you know, what's the most effective practice right now. And it's communication. So thank you for this. You know, thank you for all you do as a supervisor. I listened to your meetings. I was listening on the budget meeting last night. Oh my gosh. I just want to say thank you to all our electeds right now. I can't imagine. I mean, you know, it's such a strenuous job anyway. Thanks for doing it right now and doing the job you are. So, you know, on the behavioral health side, you know, I just wanted to say when we talk about behavioral health, we're talking about both mental health as well as the substance use disorder side. Both of those health conditions and the range of diagnoses that actually fit under both mental health and substance disorders, there are a number, right? We take them as a group, and we see them all as chronic health conditions. And as a result, you know, our agency, as well as many other agencies in the Valley, deal with both sides of that sort of equation. What we are seeing right now is for in the public system, so the system operated by the county and then services provided by the nonprofits generally, what we're seeing is that people stopped calling. They stopped calling for appointments, they stopped coming in, because they were following the orders of the shelter in place. And for many weeks, you know, we saw kind of a decrease in appointments, and what we're seeing now is it's going back to more normal. And the call center for the county is now seeing sort of the same numbers that we were seeing, referrals that we were seeing before COVID. On the private insurance side, Momentum has also private insurance, so people who have their own health insurance can call us and for mental health issues. What we're seeing is an absolute increase in the numbers of those calls, and we aren't seeing it so much yet in the public side. We think that is absolutely on the way because COVID worries, the race equity, the George Floyd murder, now fire, recession, each new calamity, and it feels like we're one calamity to the next, adds a level of pressure. And I was just talking to Janice about this. You know, for many of us in the behavioral health field, it helps so much to hear Mrs. Obama say that she had sort of mild depression.
Mm-hmm.
And
I was going to ask you about that. Does it help people?
Oh my gosh, it freed me. I just felt like that's exactly how I feel. I feel like all the time I'm just this close to just breaking out in tears. So don't make me cry today. Try not to make me cry. But I just, it just feels like that's now our new normal.
Mm-hmm.
This is our new normal.
Mm-hmm.
And our relations, how our the resiliency in our families and our neighborhoods, across our communities, absolutely what's going to get us through this. Whatever the seems to be next issue up, is we have some things to share today that I hope could help individuals and families and neighborhoods, and cope with everything on our plate right now.
Well, we have a question, so let's go to a question, and we'll fill in as much as we can here today with some of the information, the riches of information that you bring to us today in terms of the current state of affairs in mental health, and we're all eager to hear that, and I appreciate you so much. I was going to actually ask you, great minds think alike or something, but I was going to ask you about the former First Lady and whether or not, from a mental health professional standpoint, that tended to free people up for her to say, hey, look, I think I'm experiencing a low-grade depression. When somebody that prominent says that unabashedly, I think it allows people to shed the stigma and come and seek some help. So Tara, we have Tara here again today. My chief of staff is fielding the questions for us, so thank you, Tara.
Yeah, so our first question texted in is, what kind of relaxation techniques work best to alleviate stress?
Great question. It's interesting. We at Momentum, we are going to start a series on mindfulness for the staff, just so that the staff can take out time during the day, during the week, to practice their own mindfulness and meditation, sort of calming techniques that we can do in the office. Those are extended to everyone across the community, right? Is anything that can help you sort of slow your mind, give it a little rest, and there are actual techniques to these. Many online, some are being offered for free at this point because of the conditions we're in. I would also say that one thing that we're trying to also do is to highlight the necessity now of the obvious, and the obvious being good sleep, healthy foods, and some exercise. All right, again, stating the obvious, I feel like I'm Captain Obvious right now, but I can't tell you how important these three things are for both people who are in recovery, people who are in treatment, and people who are not experiencing any symptoms but want to prevent them. Those three things are so important: eating healthy, getting enough good sleep, and getting some exercise. Granted, getting exercise with air quality indexes that we have now, that means we are not going outside. We are staying indoors and trying to do some of these exercises indoors. In filtered air. So again, I just want to stress those three, and again that those meditation, mindfulness techniques are very helpful in the midst, because you can do them anywhere. That's the other thing. That's the other beauty of that.
So David, how about sleep cycle? You mentioned those three things, and you talked about getting enough sleep. And I know I've run into a lot of people professionally and even friends and acquaintances that say, I'm losing track of what day it is. I'm on Zoom all day long. If they're a professional, they're online a lot. I'm staying up later I don't have to rush into the office in the morning. How important is it for people to try to stay in a regular sleep cycle practice, so even though they don't have to rush out the door, they're still, sort of getting up, getting ready,
Yep.
and keeping that routine?
So, we feel like it is really very important to try to maintain that as much regularity in your schedule as you can. And having 2 teenagers at home, and Dave, you know this better than I do, your kid's a little older, but is maintaining that breakfast should be in the morning. Be nice if lunch could be somewhere around the middle of the day, and then dinner. Difficult to do in our house, but again, trying to, right? And so people aren't then eating dinner at 11:30 at night, and then going to sleep, or not going to sleep for another 4 hours, and then that's why you wake up too late. Now that as we're getting back into school, so the problem is that their schedules have been so irregular for many students that they may be back in school, but they may still have those nighttime hours. Again, getting folks back onto their normal sleep and eating patterns is really important. I just would just say as a point of evidence, this is why actually residential programs are so regulated as far as their schedules, right?
And when you say residential programs, explain that to our listeners.
So
some people know what that is, some don't.
So our residential care facilities for people with severe mental illness, they have very regulated schedules. So you wake up at a certain time, you have breakfast at a certain time. There's an open period. You can, just do what you want to do. And then there are groups. There's another meal. There are more groups. Get ready for dinner. Quiet time. Run it again. Right? It is so important, again, when you are feeling, off-kilter, stressed, to kind of get back into those schedules. What normalcy and some kinds of regularity. Again, when I feel like I'm getting a little out there, it feels like that I just have to return to some of those basics.
Basic schedule.
Yep.
So we have another question, Tara?
Yeah.
That's a good thing.
Yeah. So texted in, "Hi Dave and David. Good afternoon. In the past months, I've been scrutinized for not being able to wear a mask. What are ways we can accommodate people who are not able to wear masks? For instance, they have breathing issues or sensory issues, or other sort of special needs that don't allow them to."
Yeah, that's a great question. We work in an environment, our offices, I think, and I just have to say, our office, we've been open the entire time. So when the shelter in place, the order came out from the public health department, the behavioral agencies were deemed essential and had to stay open, obviously, because we're providing services. So our staff, same thing, have to wear masks, except for folks who have breathing issues or have other pre-existing health conditions where it makes it difficult for them to use a mask. In that case, one thing is, observing the social distance, absolutely. The other thing is, if people can work because of their pre-existing health conditions, if they're able to, is to be able to work remotely. We went from about less than 1% of our services were remote to now about 80% of the outpatient services are now by phone or virtual Zoom. And again, some of that is like this person who sent the question in. Some of the staff, it's because they have pre-existing health conditions and aren't able to wear masks and other things.
Yeah, I think the experts are pretty clear at this point that a mask is important, that the best ones are the N95, and having a good seal is important. But you're also hearing a lot now, we're hearing a lot from the doctors, even our county executive, Dr. Jeff Smith, that if all else fails and you can't handle that or you don't have it, even a soft cotton cloth face covering to keep to keep aerosol, so to speak, from your mouth from coming out or from coming in is helpful. Anything is helpful in terms of that, but it's a big issue, and people ask us all the time whether face guards do the job, because they can wear one of those, being to look like a clear plate in front of their face. And the short answer is none of the doctors are saying that that's as good as a mask, but if that's all you can do, and if that might save you from making somebody else ill because you're contagious, of course that's better than nothing.
Mm-hmm.
So you touched on this earlier, but a few folks have asked, how can we avoid the negative mental health impacts of shelter in place? And another person asks, how can we deal with the unprecedented amount of stress and uncertainty in our lives due to COVID and the prolonged wildfire season?
Yeah, those are great questions, and it's tough because the answer, I think, is I think we may have, especially for the second, somewhat inadequate solutions at this point. We're still, I think some of this is still we're still trying to figure this out as best we can, and like many of folks who are watching today and tuning in, I have to say it feels like we're a little off balance looking around the valley right now and seeing fires both to the north, to the southeast, and to the west. We're sort of ringed with fire. And that said, it's just another thing that's been kind of added to the plate for all of us to try to get through. That being said, one of the things that it feels to me that where it brings us some comfort are our relations and our communities that we're in, and is maintaining. In order to maintain that, we have to keep talking. And I just saw an old colleague from my federal government days. He was the former Surgeon General, Dr. Vivek Murthy, and Vivek talks a lot about loneliness. He talked a lot about loneliness before COVID, but he's wrote a book. He was on KQED a little while ago on NPR. Again, it's about reaching out and staying connected to folks. That's one of the worries we have with not only folks with mental illnesses and or substance disorders, all age ranges, right, from kids all the way to seniors, is being lonely and being alone. Right now is not the time to be alone. And I understand that there are many forces sort of working against us. I was telling Janice earlier that, and Tara earlier, that I just did a survey today on AA groups. Mm-hmm. In Santa Clara County, there would have been 39 AA groups today on Saturday. 36 of them are closed. And
it's hard for them to use things like Zoom to control. It is intended to be safe and anonymous, or anonymous and safe, and some of those 39 groups are closed groups in the first place. In other words, they don't just let anybody wander in. You're supposed to sort of qualify yourself to be in there.
Absolutely.
The old, opening statement, I'm an alcoholic and I need to be here. And people aren't so comfortable doing that on an open portal or on Zoom. And some of the groups, I think, especially when you have people that have been doing that kind of work, 12-step work, for 15 or 20 years, to suddenly shift to a platform that doesn't feel so confidential, it's hard for them. So they lose their group. And half the battle in the therapy is to have a group.
It's
the
to
idea
have a
that you have a group.
Right. You're in the connection. You're connected. You are. So, the thing that is most startling to me about that is that two groups that are still working remotely were from Los Gatos, right? And I just think that more folks from Los Gatos probably have the means to be able to operate remotely, right?
It could be.
And then the one group that's still in person that was on the list is a women's group at Alana West, and it's a closed group. But I'm just thinking all of those other 36 groups
are without their group.
They may have their sponsor, right? We have to devise ways now of being connected, of staying connected, communicating with people, still having our relations with groups, with individuals, our own family members, our friends, So I think we just have to catch up to the restrictions that we have now, and to figure out new ways of keeping those relations and communications going.
That's a great point. And so the message, I think, going back to the question, is the group itself is important. If you don't have one, get one. If you aren't somebody that's used to hanging around with a lot of male friends or female friends, this would be a good time to start figuring out how to do that.
Yeah.
Get on a neighborhood chat, get on, walk down to your driveway and wave to the neighbor. If you're on a hike, make sure you're saying hello to other people. In other words, anything you can do to foster some additional group contact or human contact, I hear you saying,
Absolutely,
is critical. And we could learn that lesson from the original principles of 12-step programs and addiction programs, where people miraculously shed their mental health and their behavioral health issues just by working with a group like that. Group therapy, some people call it, but it's really not that. It's a practice of staying connected to people who have a similar set of concerns. And right now, we all have fire as a concern, some of us more than others. We have COVID, it's a universal concern right now. We have economic concerns, we have unemployment concerns. Those of us who are employed, people often say to me, you're a government official, you're lucky you have a job. I get it, but I'm also trying to balance a $500 million deficit in our county government so that we don't lose our community services. And you're going to be trying to operate a mental health organization, a community-based organization, probably with a significant percentage of less money than you're used to because the economy is suffering around you. These are all stressors, I guess, or triggers that I would say, you and I need to be talking to people who are in this. Maybe you and I need to have a group, David.
Yeah, we should start. We can start one right here. We'll just
start one right here.
Yeah, we'll on the town hall. Something that you had said earlier too, Dave, that I thought, again, going back to Mrs. Obama saying that she feels like she has mild depression, and what we find is that people may not be picking up the phone and calling for assistance, reaching out, because of stigma. You said this earlier. Just the power of stigma, and again, in COVID and in the fire and all, is for folks to reach out.
How do they do that best?
Okay, so I just want to give a couple numbers. And these are county call center numbers.
Great.
So one is the mental health call center number, and that is 1-800-704-0900. Again, 1-800-704-0900. That line is open 24 hours a day, 7 days a week. Multiple languages can be accessed on this line.
And does it have to be for yourself, or can you call there? Let's suppose you have a loved one who's not getting out of bed all day. Can you call that number and say, I need some advice?
Yeah, you can call that number for really for anyone who yourself or others. Right?
Okay, great.
The issue, though, is that, again, this is for folks in the counties who are eligible for county services, and we have a corresponding substance use disorder number as well. So we got one for mental health, and we got one for the addiction side of the house. That number is 1-800-488-9919. Again, 1-800-488-9919, and the hours are between Mondays and Fridays, 8 a.m. to 5 p.m. So again, and there are multiple languages there. The other thing that I just want to point out is that if you have insurance, if you have health insurance, that according to the federal parity law, your health insurance, health carrier, you should have behavioral health services under your health insurance as well. That you could call your health insurance provider and ask them about behavioral health services. The other thing is that our local National Association on Mental Illness, NAMI Santa Clara, has a wonderful warm line. This number is not an emergency number, not an emergency line, but it's a warm line where you can call for information. You can talk to somebody about possible services, ask questions, and they do a fantastic job.
And NAMI is N-A-M-I. Right?
N-A-M-M-I. Yep, NAMI Santa Clara. And their number is 408-453-0400. Again, 408-453-0400, and it's option 1. After you call in the main line, option 1, and they operate on Monday through Fridays, 10 a.m. to 6 p.m. They're a wonderful resource locally. And for those, though, I just want to say, lastly, as another number, the Santa Clara County runs the Suicide and Crisis Hotline. This is a fantastic resource in the community. The county does a wonderful job on this line. And that number is 1-855-278-4204. Again, 1-855-278-4204. Now, we just want to make these numbers, provide them today because, again, it's so key to be able to reach out when you feel like you need the help. And there are call numbers here in the county where folks can try to, refer people to help. Don't do this on your own. It's too
That's great.
tough.
What a great job going through that, and I'm learning so much here. I'm going to go home afterwards and replay this and get all these numbers down myself. This is important information, and you don't know. In case you're out there and you're mildly concerned, I don't want to alarm anybody, but I will tell you I've been on this earth long enough to know that you could be in what you think is a very ordinary health situation. Everything's just humming along fine in your household or your neighbor's household or your extended family, and then just like that, somebody's triggered, and you need to have these phone numbers available if that happens, so you can start figuring out how to navigate. One of the biggest problems we know that we have in the county is that people suddenly find themselves in a situation with a loved one, particularly that's having some kind of a mental health episode, and they have no idea how to navigate. There's no GPS for that, and as David is saying, these numbers then become really, really important. Tara?
So we had Viana call in, and she asked about healthcare professionals maintaining their license across state lines when a lot of folks are transferring to telemental health. And she was especially concerned about this access for college students who may be living at home, and she wanted to see what could be done. And she mentioned there is a bill going to the U.S. Senate, and she wanted to see how we could help make sure that people could get access to these services.
Let me make sure if I understand this correctly, Tara. So the question is about licensure from another state, being able to provide services, telehealth. So thanks. From the federal government, it's been interesting is that the federal government and the state government and county, I think, it's been interesting to watch. And I say this having been a former Fed, so I just, with all due respect, to move the system, the federal system, this quickly has been nothing but mind-blowing, and in a great way. In that, authorization and waivers to be able to do the telehealth necessary to meet demand, and to allow physicians, psychiatrists, that we already have we don't have enough psychiatrists in California, to be able to have psychiatrists from outside the state be able to provide services in the state has been really helpful. And so again, I just have to say that that's somewhere where I think the federal government has done well to try to get out in front of that. And also, hopefully on that telehealth side. Any other bills that can actually memorialize this and we can make this permanent and not just covered by the waiver would be very helpful as we move forward. We absolutely have to do things differently now. As well as do what we did before well, we have to do new things even better. Okay, what I mean by that is for Momentum and other behavioral health providers in the county, a certain percentage of your folks, the folks you serve, don't have a house. They have no housing. They're homeless, or they're unstably housed. For those folks, face-to-face services was really their only way of actually accessing their services, and for us to even contact them. They may not have a phone. They don't have a connection, a Wi-Fi connection. And particularly now, as a lot of the Wi-Fi areas have been shut down. So a lot of that we have to do face-to-face still. But that new business doing it differently, those remote services are really, really key. The virtual services. So this is happening, Dave, right now all over is talking about how sort of redesigning, reinventing a lot of these services for, the safety net for people that are low income. They're, as we're seeing recession and people lose their benefits and their jobs, how do we work with this new group of folks coming into the system right now?
The county's just invested $7.1 million. I was part of that initiative to close the digital divide, because we had about 15,000 households where the kids, we know there's kids who don't have the ability to distance learn or telehealth. I mean, no Wi-Fi, as you said, you're not going to do either one of those things.
Yeah.
And of course now, and I appreciate my staff urging me along. We've been pushing, and the Board of Supervisors has been supporting doing the same type of thing with the older adult population, because there's a lot of folks that are frankly my age or older that are out there that don't have Wi-Fi connection or actually the education or the faculties, if you will, to deal with Wi-Fi and internet, or maybe they're just in a place where that's not available. The signal is not available. So if you can't close those gaps, those technological gaps, you could have all the telehealth in the world, but people can't actually access it unless they have a connection and know how to use it, right?
Right.
Yeah.
Right.
So we'll keep working on all of that. In case you just started following along on the live stream, I'm Dave Cortese, County Supervisor, but this is David Mineta with us. I haven't talked about his name much. I might later, but yes, it is spelled the same way as the San Jose International Airport, and there's a reason for that. But we'll talk about that later on, maybe if we have time. We're really here to talk about the serious subject of mental health, behavioral health in Santa Clara County, how people are being impacted by all of these crises that are happening all around us. David is the executive who runs Momentum for Health here in Santa Clara County, and he's been filling us in on a lot of things that I didn't even know, and I work on this stuff a lot. So, Tara, do we have another question?
Yeah, we have quite a few. So this next question is from Lawrence, and Lawrence asks, in the time of both COVID and wildfires, what is the county doing to make sure families have the necessities needed to remain safe and able to survive during these tough times?
What is the county doing? The county is putting resources out as much as we possibly can in a time when our own tax revenue is decreasing because of the slowness of the economy. And I'll just give you an example. We have contributed significantly in the multi-million dollars to a thing called Silicon Valley Strong, which provides services and provides even food from the food bank to families. There is so much need out there right now that it's actually almost impossible for a county, even a county government the size of ours that has a multi-billion-dollar budget, to keep up with the need, without running the county treasury into the ground. And of course, we're trying to do everything we can to continue to support the community-based agencies. Momentum for Health is one. There are many others out there that work in a network that you work with, David, informally. we're trying to make sure that the contracts from the county that help support those organizations are protected as much as possible, because they can't operate on their own without some level of county support. So basically, we have done everything from create a 24/7 emergency operations center that's constantly monitoring both COVID and the fires right now, to the more detailed and mundane issues of just making sure that we manage the treasury of the county well enough to make sure that we're not accidentally cutting off services that are really needed right now. That's basically the short answer.
So the next question is, how can parents provide support to help relieve stress in their children's lives if they're feeling overwhelmed? And Monica asks if attending school online will have negative health impacts and impacts on learning for students.
Well, I'll let you take a stab at that, David. I know the parent-child situation is one that Momentum deals with. Both transitional age youth, which is always tough if they're just 18, 19 years old, because there's laws that sort of get in the way because of privacy of parents' direct involvement. But of course, you deal to some degree with the population under 18, and what can parents do to make sure that resources are available to young people? How do you detect a problem? And how does the young person detect a problem? We're hearing more and more from the professionals about part of the problem, if you will, challenge with mental health issues is oftentimes the young person themselves doesn't even realize, unlike Michelle Obama, the young person doesn't realize they're experiencing low-grade depression.
Right.
What are your thoughts about all that?
Right. I have to confess again that this is sort of work in progress, because we got teenagers at home, so we're working on this right now.
We're all learning.
Yeah. But from both from a professional and personal position as we're moving through it right now, one of the things is it reminds me first of number one, that first principle on the airplane, that if those air masks drop, you have to put yours on first. So the adults have to put theirs on first. So in order to actually be of help to your kids, you are going to have to be in decent shape, meaning you're going to have to be, as calm, well balanced, in as good a place as you can be, given all the challenges right now. And I know that's, again, we go back to those other suggestions earlier. Number one. Number two is that communication is to be able to ask how they are doing. How are you? And to look for signs of, again, those things around sleep disturbances, mood irritability, all kinds of indicators that could tip a parent off to distress by their kids. Maybe they aren't talking as much. Maybe they are not enjoying what they would normally have enjoyed. Those kinds of things, right? And again, engaging in that discussion with them and being able to track over time if there are any changes in their moods or behaviors. And then, again, reaching out, talking to other folks. How normal is this? You talk to other parents. This is my kid. My kid's doing that same thing right now. And then understanding what's sort of the normal curve right now and what is going to be outside that normal curve. Because, again, we have a whole different baseline right now. Kids who are staying indoors pretty much most of the day, and I'm not sure if folks, other parents out there could relate, but kids on video games for most of the day. Again, new normal, right? So we got to see what is, through communicating, is, again, checking in on seeing how they're doing. It's hard to say about if they're staying at home, they should be, or going to school, actually on campus. It feels like pretty much for public health officials and the public health folks, dealing with the pandemic first, and then all the other issues around education, and doing our best to keep our kids as up to date educationally as we can under the circumstances. it's we're watching all those viral outbreaks in school districts and schools across the country as they open up again, and it just I just have to say I'm so grateful for our county leadership on this, Dave, and we're going to try to we're going to honor Dr. Cody at our Shining Stars Award on October 2nd.
Great.
And she's accepted. Just to be able to say thanks to Dr. Cody. Sarah's I think we're so lucky, as you often say, the board says, how lucky we are to have Dr. Cody.
I was just going to say that you kind of pointed this way when you said the leadership of the county, but there's a whole bunch of people down there that are way smarter on this pandemic stuff than I am. I'm just there trying to ask the kind of questions that we know that the public wants asked. We're trying to make sure the dollars of the county are invested properly, because we're in charge of that, not her, to deal with some of this stuff. And we're trying to stay as educated as possible, even though I'm a doctor of the law, not a doctor of medicine, right? We all have our different expertise levels. So I remember starting off saying, let's just listen to the experts and try as much as we can to be disciplined about doing what they say. And I think by and large, it's worked here in this county as well as anywhere, despite the fact that it's not perfect. It's not perfect. David Mineta is our guest, and he's answering your questions, and it looks like we have another one, Tara.
And this will likely be our last question. It's from Angel Online, and she mentions how the isolation of elderly residents in their long-term care facility has a mental health impact on them and their families who can't visit them at this time. And she wanted to know if you know of any innovative approaches you may suggest for these types of situations.
Again, this is some of what we're seeing in our facilities, our 24/7 programs, residential programs. We aren't taking any more visitors, no more visitors from outside. They can't come in. So if there are other ways that people outside, family members, can connect with their family member inside the facility, either through, again, calls, making computers available, tablets available for those virtual connections, those kinds of things. My wife, we had a family member who was pretty ill and ultimately passed, and before she did, we had placards on the sidewalk in San Francisco as she could look out her window still.
Mm-hmm.
The phone call, the group family phone call from the sidewalk. We're inventing new ways as we go through this right now, and of staying connected, of showing how much we love somebody under the most difficult circumstances. But I think it's that sort of imagination and different ways and creativity that's sort of serving us well. Because we had seen another family do it. It was, let's do that.
Yeah, it's you kind of have to. It's the necessity breeds invention, coming right back again. But boy, the nursing homes, so to speak, we never used to seem to call them that before. We call them, adult living centers and such, but they've been hit so hard, and there's such a big percentage because of not only the vulnerability, but any congregate facility, any facility where you have people staying in close proximity for long periods of time, tends to pass this virus along very quickly and very viciously, frankly, to the point where numbers of people will be infected. And then how do you get somebody in and out? There are ways to do that with testing, and the county has some protocols, but it's a challenge, and it's heartbreaking and heartwarming to hear at the same time some of the stories about how people have managed to figure out how to comfort their loved ones who are kind of stuck on the inside. Tara, you have one more question?
So this is a fun one. Are there any apps that you recommend to help relieve stress?
There's some good, you were talking about mindfulness, there's some good meditation apps around. I've heard people say, I can't meditate for 15 minutes or 30 minutes, but there's even ones that'll just put you on a 1 minute guided meditation or 2 minutes.
Yeah.
What else is out there, David? Are there things, tracking your exercise is fun? You talked about exercise.
Yeah, I think there are a lot of
Tracking-
exercise apps. There's some yoga apps. My wife was asking about that the other day. She's like, "What is this?" Like, I haven't downloaded a yoga app. I haven't actually opened it up yet, but I have downloaded it.
That's a start.
Yeah,
That's a
it is.
start.
I thought that was a good start for me. And actually, there are some that are actually being offered now because of the pandemic. They're being offered free, right, to community members. So, both again, yoga, mindfulness, exercise apps. I think are
There's some good nutrition apps out there.
Yeah.
If you think you're getting off of your nutrition cycle, which I think probably a lot of people are, you're not moving around as much as you were, or
Yeah.
racing around town, and
Yep.
all of those are good. But
Yeah.
why don't we ask that caller or texter to post in the chat room any other good apps they know of. We're not here to market anything, but if there's something good out there that are that people should know, we get sometimes several thousand people who end up checking in or watching this COVID-19 town hall, and I'm sure some of them would like to hear about some of those apps. So we got to wrap up. I have to tell, it's a little a personal point of privilege, like we say in politics, is that David is very humble about his beginnings, and I suppose his family has as humble beginnings as anyone, probably in the valley. But his father, many people know, was the mayor of San Jose when you were growing up, and then went all the way to become a cabinet secretary in 2 administrations in Washington. And I've always been so proud of the fact that you've taken the mantle of leadership here in the community, especially in an area so important as mental health. Some people do politics, some people do, and you've done a little bit of that. You've been an elected official before. I think at the school board level you've served. But you chose to go into this area, and maybe you could, look into the camera here to close this out and let people know why you're so passionate about mental health, and why it's so important for them to take the steps necessary to take care of themselves, or anything else you'd like to say to close this out today.
Well, thank you, Dave. And I again, our dads go back a long way together. So it's great being able to see you, and I see you in action. I get to see you on the supervisors meetings all the time. So again, thank you. Really, this is mental health is important to me, and I feel like I sort of got a career when I had a family member sort of going through his own issues around probably depression and some teenage use of substances, and I feel like I found my career at that point. And it's I've been so fortunate ever since. Sort of as you found your calling, I feel like I found sort of mine, and it's particularly important now. The last thing I just would want to finish with, just to say, is I just would want to thank all of our behavioral health providers, our frontline staff, our back office staff, not just for Momentum, but for the 30 plus behavioral health agencies in the county. Just like our first responders, we've been open the entire time serving people. And our hospitals, just like the hospital staff and all, who, again, thank you to all of them. But oftentimes the behavioral health staff sort of get left behind. And I just want to thank our staff and our back office staff for keeping things going so we could stay open and meet the behavioral health needs of thousands of people in the community right now who appear to be, in some ways suffering more and more as each calamity seems to, present itself. So I just want to thank our behavioral health staff, not just for Momentum, but for all the agencies, all 30 plus agencies across the county right now. and all the county behavioral health staff as well.
On
So
behalf of the Board of Supervisors, thank you, thank them. We're grateful for all of them stepping up really as the heroes of our community. That's not an overstatement, it's an understatement. People putting their own health on the line to make sure that others can stay healthy. There's nothing more in life more profound than that. So thank you, David Mineta. Thank you for being here. What a great education for all of us today. And hopefully we won't need you back, because they'll get a vaccine and COVID will be over with, and the fires will all get put out, and everyone's going to be back to going to Disneyland again. But if not, we will reserve the right to call you back here.
would love
to
to.
help us with our mental health. Thank you
Would
so
love to.
much, and we'll see all of you next Saturday. We should be scheduled here, and we'll either have Janice Rombeck up here with me, our communications manager, or we will have someone else here as a special guest, but that'll be a surprise. Thank you.